Hi, I'm Dr. Fred Venditti, Executive Vice President for System Care Delivery and Hospital General Director here at Albany Medical Center, bringing you the update on coronavirus and other events here at Albany Medical Center. I'm joined today by Dr. Arup Dey, the President of the Albany Medical College Faculty Practice. Welcome, Arup.
Thank you. Great to be here.
Let's start with the numbers. Here's the slide that we always show of the admissions across the region. We're at 60 today. So, Arup, we've been hovering in this range for a while. We've been obviously much higher in the past, 555 way back in January. So we continue to perform well as a region.
Great news.
The next slide is the admissions and discharges, and we had another day without any admissions, you can see on this, but we're kind of in balance. And the third graphic, we'll throw that up. This is the census here at the medical center. Today we have 11 in the hospital. 8 of them are on the floor, 3 of them are in the ICU, and 1 is on a ventilator. So that continues to trend down as well, which is really good news. Yep. It has. And I would remind everyone we were well over 160 back in January, so all moving in the right direction.
Yep.
Let's flip and talk a little bit about vaccines. So we are now up to 637,000 individuals in the capital region that have received at least 1 dose. It's really fantastic. So for those folks 18 and above, that's over 70% of the population. And the whole population, it's almost 70%. So that's really good.
Huge, with the vaccination efforts for the over 12 group continuing.
That's right. 550,000 Capital Region residents have completed their course of vaccination. That's 51.1%. And in the over 18 population, that's 62%. So those numbers really are why, in great part, we're seeing a decline in cases, right?
Cases both for patients and our staff. I mean, we've had several days now where we've had no cases amongst our staff or no one testing positive.
That's right, and we've been testing very few staff because there really hasn't been a lot of exposure. Yeah, that's terrific. So, Arup, 1.8 billion, does that number ring a bell for you?
Huge number, but it does. I guessed correctly. Number of worldwide vaccinations.
So obviously there are billions and billions of people more to get vaccines, but on the Johns Hopkins website, they actually track how many doses of vaccine have been administered worldwide, and it's closing in on that number. So really, really fantastic. So we have fielded questions in the past about the durability of immunity, both from natural infection as well as from the vaccine. There was an interesting development yesterday, right, Arup?
Really answers the question of how long the vaccination lasts and is good for, because there was a lot of debate about that when a vaccine first started coming out. Is it 90 days? Is it longer? But this study from Washington University.
Right, Washington University in St. Louis, they did something very interesting actually. They not only measured the immunity in the bloodstream, but they had a group of volunteers, I think it was 18 folks, who underwent bone marrow biopsies. And that allowed them to actually look at the cells, the plasma cells that are the cells that sort of sit quietly in your bone marrow and wait for that virus to come back and then can generate antibodies. And what did they find?
They found that there is actually lasting immunity, and when they are re-triggered or re-exposed to virus, they are able to generate an appropriate immune response and generate antibodies.
So it really does suggest that, particularly if you've had an infection, if you've had the COVID as an infection, that you're going to have long-lasting immunity. More information to come, small study. I'm sure there'll be more studies like that looking at other kinds of cells, killer T cells, memory cells, et cetera, that will help guide us in the future.
Very encouraging.
Very encouraging. So let's change gears here a little bit. Arup, you've been working on a project, and I think you're getting close to completion. Why don't you tell us about it?
Thanks, Fred. So yes, we, the practice team, many people have been working on this project. So we have a new multi-specialty service site, clinic, opening up in Amsterdam. I hope we have a picture of it to show you. It's a beautiful facility.
Let's pop that up.
So really, aesthetically, very appealing, beautiful place, brand new, and it's going to continue to deliver care, really a model that we've been using for several years now, of bringing really top-tier, subspecialty, world-class care out to you in the community. So we've done that.
And Arup, we probably have representation of almost every specialty we provide out in the community, right?
I think almost all of the subspecialists, gastroenterologists, maternal fetal medicine, urology, go at clinics is from Glens Falls to Volusia down to Hudson. And so this continues that theme, and now we're spreading westward to help the population in Amsterdam, out towards Utica even. And some of the focus at this site is going to be a pediatric focus, so pediatric subspecialists. So some of the people, if I can, who are going to be there. So Dr. Kozlowski from Pediatric Pulmonary.
That's great.
Dr. Howe from Pediatric Urology. And then Dr. Alawat, Pediatric GI. And then we have Dr. Ostroff from Pediatric Rheumatology and Dr. Dutt, Pediatric Orthopedics. So a really great combination there, knowing that some of those pediatric bone diseases are they bone, are they rheumatologic, is there some element of both? So they'll both be there.
So Arup, it's perfectly situated not only to serve Fulton and Montgomery County, but probably a little bit further west. We do draw from the Utica and Little Falls region, so this will be a lot more convenient for patients from that region.
Absolutely, and again, the team, it was really a comprehensive effort, did the background and the research for that. That's what we saw, that some of these patients are driving very, very long distances to get to us. So I think being able to be in the community and be able to deliver that care much closer to them is really a service. And that's just the pediatric side. So we also have vascular surgeons who have been in Amsterdam for many years who will continue. So Doctors Roddy and Byrne and Laser will be there, as well as other adult specialties that we're working through.
That's really tremendous. I know you've been working on this a long time. It's I'm sure delightful to see it come to fruition, and I think things start on Monday or Tuesday, right?
So things start next week. On Wednesday we have our first vascular visits then, and then the following week we have our pediatric subspecialist starting there. So it's very, very exciting to see a project like that go from really blueprints, and not even blueprints, just conceptual,
right.
Do we have demographic data to look at this, to go to a beautiful building and being able to service, bring these types of services to patients out there.
That's great. Now that this is under your belt, I assume you're going to be working on another project soon. So we'll keep that
Sounds great.
under wraps for now, but something more, I'm sure.
We do.
Coming.
There's more on the list to come.
That's terrific. Okay. Well, I think that does it for today here from Albany Med. This weekend is Memorial Day, and we're going to finish the video with our national anthem. We did this last year, and this is a tribute to all those members of the armed forces that have given their life for our country, which is what Memorial Day is all about. So, we'll be back next week. Please do take care of yourself, take care of each other, and please listen to the national anthem.
Oh, say, can you see by the dawn's early light what so